I'd like to introduce Dr. Holly Lucille. Dr. Lucille is a nationally recognized licensed naturopathic doctor, an educator, a natural products consultant, and a patient advocate. I have listened to her educational presentations before, and I always walk away enlightened, and I believe that you are in for a treat to learn about detoxification. She is the author of several books, including Creating and Maintaining Balance, A Woman's Guide to Safe, Natural Hormonal Health. She is an expert in the field of integrative medicine and has appeared on Dr. Oz, The Doctors, Lifetime Television for Women, PBS's Healing Quest, the Hallmark Channel, and Discovery Fit and Health Channel. She has done innumerable other interviews as well as radio shows, and I am thinking that you are really going to enjoy today's presentation with Dr. Holly Lucille. Welcome, Dr. Lucille.
Thank you. Thank you, thank you, thank you. Thanks so much. Thanks, everybody, for being here. All right. The controls are in my hand, correct?
Yes, they are, and we're ready to listen.
All right. And, yes, welcome to the best webinars in the world. I swear, thank you. Lexi, Cheryl, I need you to run my entire life because you run these webinars so darn well. Okay, so let's get right to it. Really great topic today. Easy ways to detoxify every day. And it's quite true what Jim Rohn says, take care of your body. It's the only place you have to live. Boy, oh boy, for any of you that are attending that have had health issues or things sort of break down in your body, it definitely gives you perspective and certainly can clarify what's priority when we wake up every single morning. And so taking care of our bodies, being healthy, it's really, it's just invaluable, especially in our modern day that does provide us with challenges that you don't even know about. And obviously, we all have challenges that we are quite aware of, but hopefully today I'm going to sort of unfortunately shed some light on challenges that are affecting your body and your health that you might not be aware of, okay? So awareness is power, and then I always say self-awareness is superpower. So we are on the road here to get more powerful today. So we, unfortunately, are constantly exposed to toxins. And this list that I have here, it's just the beginning, quite honestly. Definitely from our food. There are things that I learn each and every day in the circles that I run in regarding how I can eat more clean. And I didn't think at one point in time it was possible, but it is. Our environment for sure. Almost every day, if you are exposed to any news cycle, you will read in the headline about an environmental toxin that we're getting more and more research on, especially how it is affecting our bodies at a cellular level, from the water that we drink, from the air that we breathe, certainly from the things that we put on one of our largest detoxification processes, or our largest detoxification organs, I should say, and that's our skin. So we think about health and beauty aids, or also, household cleaning products as well. And then certainly there are things that contribute to these toxins sort of burdening our body, and being overstressed and having toxic emotions can be one of them. So there was a recent study that found that now, when you get to my age, over 50, you're like, okay, I've been kicking around on this earth for quite a while. I live in Los Angeles and I can take a great hike, but I get up and it's an interesting color of green, but there's a green ring around the lovely city that I live in, and that's all that smog, right? Well, this is about umbilical cord blood. These are babies that haven't even had a chance yet, right? So it found that it contained almost 300 chemicals. That's mercury, PCBs, pesticides, including toxins that can cause cancer, disrupt brain and nervous systems, and contribute to birth defects. And so it's a big problem. It's something that we definitely need to think about. And like I said, awareness is power, and that's why we're here. So one of the things that I certainly see in my practice, and it has gotten my attention more and more, I would say over the past decade, but certainly over the past 5 years, is as a naturopathic doctor, I am taught to identify and treat the cause, and it's very important to me, right? So let's get in there and not just suppress symptoms, like if you are this person with constipation, you know, and taking a stimulating laxative, or if you are having problems sleeping, let's give you a sleeping pill. Or if, you know, you are complaining of being fatigued, I'm like, well, you just need an antidepressant. That's not how I practice. We strive to get in there and understand all of the contributing factors to why somebody would present clinically, right? And so I have to tell you that, when I have good clinical acumen, which is hopefully all the time, and I really sit with somebody and work hard to understand who they are, what their story is, what their experience has been, what their body has been through, where they've lived, where they've worked, all of the things, I have to tell you, 2% of the time, at least a major contributing factor is an overall body burden of toxins. And so the cool thing is, once we understand that, we can take steps to truly identify and treat the cause, and then people get to start healing from the inside out, and they can shed all of these uncomfortable, certainly signs, symptoms, and diagnosis, okay? So it's really important to not just, I've always said that there's value in all systems of medicine, and certainly reductionistic allopathic Western medicine, there's a place. I've, had a big major shoulder surgery. I've been in a motorcycle accident. Very thankful for urgent and emergent care to people, for folks to reduce me to, hey, what's going on right there? But when we're talking about these things that are chronic, and if you are experiencing them, let's think a little bit deeper. I think it's important that we go a little bit deeper. All right. So detoxification to the rescue. Yes. One of the things that I really want to make clear is that our bodies do have a very natural ability to collect and protect from these toxins that we are exposed to. We deal with them mainly through our liver, a major detoxification organ that goes through phase 1 and then also phase 2. My analogy about phase 1 and phase 2 regarding taking these and neutralizing these toxins into products that are water soluble, so we can, usually these are fat soluble, so they're water soluble, so we can get rid of them through our various emunctories. I'll talk to you more about what that is. But phase 1 would be like you going around your house and grabbing all of the waste paper, from the bathroom, from the kitchen, from your bedrooms, and then just sitting it outside. Okay, so you collected that. And phase 2 is like the garbage folks coming along and taking it away. And honestly, both phases have to be working and functioning efficiently and properly. And a lot of times, because of our overall body burden, this natural process that we do have becomes inefficient. And that's when we start to feel kind of like I'm feeling a little toxic, okay? Those fatigue, weight gain, hormonal imbalances, etc. I hope I'm going to remember this, right? But I saw a funny, my parents used to live in a small lake town in Michigan, and the bumper sticker that I saw at the gas station there said it was from a local brewery, and it said it said if beer needed to be filtered, God wouldn't have given us livers. So it was an advertisement for their unfiltered process of making beer. But I thought that was kind of funny. So it is a natural process. We do have it. It's ongoing. It is necessary for survival. But I think the take home here is that, unfortunately, because of the things that I'm going to be talking about, this process becomes inefficient, and it can break down, especially phase 2. And then we're really feeling bad, okay? All right. So, when we think about daily detox tips, I know that there's a whole push around the start of the year where it's new year, new you, every single year. And there's a lot of detoxification processes that are that are packaged up and sold on the internet, and you'll see them everywhere you go almost. But honestly, in my opinion, and what I've seen clinically, it doesn't certainly have to be reserved for, the holidays or New Year's resolution. There are, I think, quite honestly, what I see is an everyday detox. And so I always like for people to just participate in everyday detox. It's kind of like the tide comes in, the tide goes out. It's like this ebb and flow of life, right? And detoxification for me, I mentioned before, it's all about opening up the emunctories. And an emunctory is an old-fashioned medical word that basically means it's an organ or a part of the body that carries out waste, kind of like your skin. Or when you think about defecation, right? So getting things out through your bowel movements, urination, perspiration, certainly, emoting, all of those things. And so it's opening up. So we talk about proper nutrition because that detoxification process that is very natural is fueled, though, by vitamins and minerals. And if you are deficient, it could be another reason why it's inefficient, okay? Oil pulling, we're going to talk about that. Extra exercise, dry skin brushing. Epsom salt baths, one of my favorites. Supplementation, very, very important, especially if there's an overall body burden. I have had this thing living in Los Angeles and seeing the clientele that I do where I came up with, hey, you got to supplement your lifestyle because, I've got Sunset Boulevard right up there, and there's a lot of folks that are really working hard during the day to, have their day job and then play in the clubs at night because they are, spurring on their music career, or we've got actors and actresses trying to make it, and their lives are so full of compounded stressors, and then their lifestyle is full of trying to medicate their wake cycle with caffeine and trying to then sort of come down at night with alcohol. And so supplementing your lifestyle, and certainly from a detoxification process, is extremely important. We're going to talk about how important water is, and believe it or not, meditation. Yes, it can be very effective. Emoting, it's a huge, people don't think about it a lot, but it's a huge part of a detoxification process. So, dry skin brushing. This is so, and I love some of these tips so much because guess what? Pennies on the dollar. They do not cost a whole heck of a lot, and these are things that you can do every single day. If anybody has not dry skin brushed before, go get a brush that we talk about here and do it. It feels so incredibly good. Your lymphatic system is sort of like the drainage system of your body. While blood brings the nutrients into the cells, the lymph system helps to remove other junk and debris, okay? And so the blood in our body is pumped via the heart. The lymph system does not have a master pump. So when excess sort of junk accumulates, what you can get is blockages. That can occur and prevent the excretion of waste materials, and certainly prevent it from being excreted efficiently. And so dry skin brushing has been used for thousands and thousands of years, and it certainly is a way just to keep things going. The skin, I said before, is the largest organ, and it's definitely a huge organ of detoxification. 1/3 of the body's toxins are eliminated through the skin. And so that dry skin brushing, you use a natural bristle brush. At my local farmer's market, we've got a whole booth of these natural they're made from bamboo, and then the natural bristle. You can get them in different courses, so different textures. So if you're sensitive, you can kind of dial that down a little bit. You definitely want to avoid any sort of sensitive places. I seem to react sometimes on my arms, and so I use a different brush for my arms than I do the rest of my body. But you want to be able to I start at the bottom of my feet because that's where your nerve endings are, right? So you kind of wake yourself up there. You just start brushing long strokes up one leg, up, and you always want to be brushing towards your heart, okay? Now, I suggest showering afterwards, and you want to do this dry because this is where you start to really affect that lymph flow, and as well, you can the skin, you're turning over those cells, and so really important to do it dry, and then you shower afterwards, and then use one of your favorite moisturizing oils. If it has a scent to it, you can actually use aromatherapy in this process as well. And I I have people do this at least once or twice a week. If you can get it into a daily process, I think it's something that you're going to see makes such a huge difference, okay? And it's one of those things that we can, retox, and then this is detox. There's everyday things that we come in contact with that we don't even aware of. I mean, when I lecture across I'll see a show of hands, because I'll just ask, how many people use, well, actually, you know what, before we go on, there's a question that I have. I mean, I have about, in my practice, about 21 questions. I'm going to read you a few of them, okay? So, do you regularly eat processed foods? Do you eat large fish? Do you consume any high fructose corn syrup? Are your homes, home furnishing or home finishes new, and do you smell like an outgassing? Do you live in a house or work in a building that has mold? Do you have mercury amalgam fillings? Do you know if there's fracking wells or pipelines in your region? Is there a nuclear power plant in your region? I go on and on and on and on, but because it helps me understand. How, and people don't even realize it. I'll talk to women, I'm like, do you use Windex? Do you get your nails done? Do you color your hair? And these are people that think, hey, I'm eating pretty clean, I'm doing pretty well. And then I'll kind of ask them all these questions, and then they start to scratch their head a little bit and go, I do all of that. And so every day, sort of low levels of exposure that accumulate over time. Another thing from food perspective, people are like, yep, I get organic broccoli. I'm like, but how do you take it home? Well, I put it in that plastic bag that they have hanging there. I'm like, oh, okay. I know, right? But their studies have shown that once again, our food, it's so, easy to get these passive exposures to toxins every day. So that's why we're talking about this. Okay, so Epsom salt bath, another one of my favorite. It's just something, once again, I think baths are calming. And this natural mineral compound formed from magnesium and sulfate, the minerals help to pull, it's a drawing effect, helps to pull out toxins and relax the muscles. Magnesium, first of all, my gosh, I have seen magnesium deficiencies across the board in my practice lately. And magnesium is so crucial for hundreds of chemical reactions in the body. It plays a huge role in the detoxification pathway. So that's where that nutrition comes in. We need to feed our biochemistry so our bodies can work appropriately. And also, we're going to talk more and more about glutathione. It's required to produce glutathione. And glutathione is a huge antioxidant involved in both phase 1 and phase 2 detoxification processes. And it is the first thing that actually gets decreased when we've got exposure to these toxins that we're talking about, okay? So it's almost like a double whammy I see. Somebody asked me the other day about calories. They're like, hey, do you really think a calorie is a calorie is a calorie? I was like, nah, nope. Because my answer was, if you're eating a caloric food, okay, so let's just say a muffin or a donut. They're one and the same to me, quite honestly. I mean, one has a hole and the other one doesn't, and it's probably high in calories. If you look at the packaging, they'll probably say 250 calories, but that's just for either a half or a third of it. But when it's high in calories and then nutritionally deficient, and it's a refined food products that probably has some high fructose corn syrup or refined sugars, what you're doing, in my opinion, is a double whammy. Not only are you not feeding your body the nutrients that your body is required to have in order to function efficiently and properly and optimally, you also are given it a wham bam with inflammation and oxidative stress. And I think that's where a calorie is not a calorie is not a calorie. Okay, so I digress. Anyway, so back to Epsom salt baths. Light a candle. Once again, the use of essential oils, I always flip a couple drops of, I had a head cold last week, and so when I was taking my Epsom salt bath, peppermint oil, that eucalyptus was really, really good, and you can always use those essential oils to enhance these detoxification processes. So goal is, I would say, 2 cups of Epsom salt in a body of water for at least 20 minutes, and anywhere from 3 to 5 times a week. Anytime you can do this is absolutely wonderful, and it definitely contributes to stress reduction. All right. So oil pulling. There was actually a study I want to talk about. There was a couple different studies with oil pulling, and if you don't know what that is, that's basically placing oil, organic of course, in your mouth and really just swishing it, pulling it through your teeth. Okay, so people in this study either use sesame oil or chlorhexidine, which is an antiseptic mouthwash. We're probably, quite used to. And what they were studying, they were assessed for gingival index, plaque index, organoleptic breath assessment, and then another breath assessment. So basically, there was a statistically significant difference in the modified gingival index and reduction in organoleptic breath assessment with the oil pulling. That's just after 10 days of oil. So decreased plaque and aerobic microorganisms. That's huge because honestly, your dental health can affect the rest of your body. Systemic inflammation, fatigue, poor dental health, even if you don't know it, right? Because there's little things where those microorganisms can get in, whether you've had a crown or a cracked tooth or a root canal, and cause a silent infection that you don't know about, and that's really contributing to how you feel, and improve gingival scores across the board. So that's pretty great. So oil pulling is one of those ways, once again, very inexpensive, that you can do on a daily basis to help decrease our overall body burden. Now, what am I talking about? A little bit of extra exercise. I think this is important, and this is something that I talk to people about, especially around the holidays. And the holidays are a real kicker for folks because, boy, oh boy, it starts in October. We know that all of that stuff, you'll see that candy come out around Halloween, and then we go into November with Thanksgiving, and then the December holidays, and then New Year. I mean, we have a bona fide holiday season. And I believe last time I checked, the average weight gain, if you do not do anything differently, is 7 pounds through that 4 months. And so if you don't do anything differently for the next year, pretty soon you're about 20 pounds overweight and you're like, what just happened, right? And so this is where I encourage kind of like the balance, all right, a little extra exercise. Because of course, what we can say so much from a clinical perspective about exercise: cardiovascular benefits, bone health benefits, sleep-wake cycle benefits, increasing, the lymph system, enhancing circulation, mood elevation. So there are all sorts of things that you can do. Kettlebells, if you haven't used them, they're really easy to get and they're really easy to learn how to use, and you can have them in your home. Try alternating between high and low intensity workouts. You can use kettlebells once or twice per week, walk, bicycle, yoga once or twice per week. There's a lot of different things that you can do on your own. You can use your body weight. There's many apps. There's a body weight app out there for your smartphones. So that's just simply doing air squats or jumping air squats, or sit-ups and push-ups, but there's also things that you can learn like side planks, and then rebounding. I'm going to talk about rebounding because it's so much fun. If you've never rebounded, let me tell you something. By all means, be careful because I get carried away on this. The goal for rebounding, I would say, is 5 minutes, 5 times a week. It's just fun. I mean, let your little kid come out and you're on a little trampoline. But 12-week clinical study involving overweight women showed that rebounding actually improved body measurements and composition, significantly decreased blood pressure, balanced lipid and glucose levels, increased exercise capacity, and decreased pain severity because it's very low intensity, right? You're just rebounding. Do it with a friend. They're very inexpensive, these rebounders are. Just grab yourself some space and get on that rebounder and do it. It's so much fun. You giggle, you laugh, and that, in my opinion, is another great way just to kind of let go and detox, all right? So trampoline rebounding, can't say enough about it. Okay, another thing that people, I actually, obviously because I'm a clinician, I draw blood and I do other tests to confirm clinical suspicions, but you know, in our kidneys, there's a couple of different markers, BUN, creatinine. I am starting to see people come up on blood work and nothing else is wrong with it. And I'm like, you're dehydrated. And by the time it's showing up on blood work, there's absolutely, it's just something that's so optional, right, and completely modifiable. And I promise you, when you start drinking the water that you need to drink, it's going to make you feel a lot better. A lot of times in my practice, what I hear from people is they feel tired or hungry. And I like to educate that I don't think that you're that tired or that hungry. I think you're that dehydrated, because it can certainly show up. And if you can knock out hunger or fatigue with a little bit of extra water, why not? But the other thing about hydration when we're talking about detoxification is that it carries nutrients to cells and waste materials out. It keeps, we're 72% water. You know, it's like, it is the liquid of love for our body. One of the things I encourage my patients to do if they don't like water is, you know, try, if you've ever gone to a spa or, you know, a gym where they've got like the cucumber water and you're like, gosh, it smells so good, it tastes so good, and you want to drink it, right? Make it at home. Oranges, lemons, limes, whatever it takes. I love bubbly water, so I have one of those soda streams, and it definitely increases my intake of water. Definitely, because water is such a source when it comes to providing toxins when we don't want them. We want to definitely avoid drinking out of plastic, not only for our bodies, but for our environment. And then filtered water. People always ask me, this is one of the biggest questions I get across the board. What kind of water do you drink? I have a home water filter called Berkey. It's a Berkey water filter. And I've done my research. So we all have glass water bottles, glass cooking stuff we've got, and then I take the water out of the faucet and we put it into our Berkey filter. We probably, probably go through about, 3.5, 4 gallons of water a day. So the pets eat that, we cook with that, I drink that. That's what I've been able to do. And that I finally sort of like settled on. I've got water filters, of course, in my shower to decrease the chlorine and all that great stuff. And so that is something that I think is extremely important. So what I like to say to people is, I mean, if you have a weight loss desire, first of all, I'm increasing it up to 3 liters. My buddy, Dr. Jacob Teitelbaum, if you have any adrenal dysregulation issues, he wants you to drink a gallon of water a day, salted water, a little Himalayan pink salt in there. But I would say at least half your body weight in ounces. So if you're 150 pounds, what is that, 75, 80 ounces of water a day. If you drink caffeine, which decreases ADH, which is your antidiuretic hormone, you want to add 60 more ounces to that. Or if you are partaking in alcoholic beverages, another dehydrating liquid, we want to add water. So you can kind of, I have people have fun with it, get a water bottle that they name, they kind of hang out with like their friend, name it, keep it in your way. I do, every time I see a patient, I make sure I have a mason jar in my office what is either has tea in it or water, and I know that during that hour I am definitely going to go through that mason jar, and so that keeps me hydrated throughout the day. So just have fun with yourself. As I said, nutrition is extremely important. There are many lovely detoxifying foods. I think it's important that absolutely 100% that you eat organic when possible. There's a great resource. I know we've talked about it before, but it's EWG.org. Okay, so environmentalworkinggroup.org. They are a 501c3, so a nonprofit organization that does a lot of studying on our environment. And the resources that they have are pretty amazing. So they've got a cosmetic database, right? So you can throw in your cosmetics, what you're using, and it not only tell you if it's good, bad, or ugly, but it'll also tell you and give you other options, resources where you can get these things that are free of toxins. Once again, skin, we definitely are getting things out, but it's another place where toxins come in. These toxins in our environment are usually fat soluble, so they pass through our skin, they accumulate over time in our cells, okay? Definitely use spices. Spice up your breakfast, eat the rainbow, so color. Fermented foods are great, so we're populating our microbiome, and definitely increase fiber. Fiber is one of those things that we need because that's what binds to the toxins that our body is working so hard to get out and creates that nice bowel movement, that along with water. Okay, so you all know you're on the Cherry Natural webinar, and I know you definitely are good eaters, but these are things to think. You know, when I get somebody in a clinical situation where we know we've got to clean things up and decrease their overall body burden, I always talk about eating for an outcome, okay? It's not just eating for taste anymore, but you want to eat for an outcome, especially when we're trying to get things out. So extremely important, all right? Other detoxifying foods, just think about whole grains, definitely vegetables. The cruciferous vegetables are wonderful. You'll see all these pictures right there. Excuse me, nuts, lemons, onions, and garlic. Great, great, great to stimulate detox as well, all right? So nutrition. So let's move over to supplementation. Once again, our bodies have this natural detoxification process and usually do a great job of dealing with toxins, but honestly, I think that I get to a point where I see in my practice, I've said this over and over again, where there's this overall body burden where that natural detoxification process just starts to become a little bit inefficient. And that's where supplements to the rescue. One of my favorite ones right here is curcumin. So let me talk you through what you're seeing here on this slide, because once I do, so you see here, slide number A, which is your upper left, okay? So this is the control slide, okay? I'll just read this. Curcumin, I mean, it truly is. Now, we know curcumin as the active component of turmeric, all right? And this is a slide that represents how hepatoprotective or how good it is at protecting the liver. It's one of the most healthy, most liver healthy compounds in the world. So drug-related hepatotoxicity accounts for that. That's damage to our lovely liver, accounts for 50% of liver injuries, including both chronic and acute liver disease. So what we're seeing here is a study on acetaminophen. Okay, it's a very gnarly substance that can do quite some damage to the liver. So, so A represents a control animal showing normal cells, and what you see there is a central vein. Okay, I just want this to make sense to you visually. B is a curcumin animal, also with a normal central vein and portal tracts. You'll see that there. Okay, the PT is the portal tracts. So these are things that are in the liver itself. C actually shows liver damage associated with acetaminophen. Okay, so what you're seeing there is coagulative necrosis of hepatocytes and leukocyte infiltration. So this is how the liver cells start to get damaged. And when you draw your blood, people, when they have liver enzymes that are elevated, what happens is that, you know, there's these hepatocytes, these liver cells have they're specialized, so they've got all these little enzymes working away. And when there's damage to the cells, which you're seeing right there in slide number C, those enzymes seep out into the bloodstream, and then of course when we get phlebotomized or somebody takes your blood, we can see that those enzymes are actually elevated, something that we don't want for sure. But D, here's the kicker. Slide D shows the reduced hepatotoxicity in the acetaminophen plus curcumin animals with only small amounts of damage. So you'll see right there, that's kind of highlighted there. So it just really is a graphic representation of how darn effective curcumin is. And acetaminophen is straight on, you take it and your liver is, bam, exposed to it. But curcumin does an amazing job at warding off the damage from the toxins that we've been talking about for the last half hour, okay? Curcumin also has been shown to effectively neutralize free radicals, all right? So those are oxidative stress, and increase the activity of key antioxidant enzymes, including glutathione peroxidase. This is really, really important because this is what I was talking about. When we're exposed to these toxins, we've got an increased level of oxidative stress, and a decrease. What it does is it plummets our antioxidant reserves and our then ability to detoxify appropriately. So curcumin also does a wonderful job in being able to replenish and recover one of the most important antioxidants, and that's glutathione, all right? Yay, curcumin. And glutathione, we can't talk about detoxification without it. It regenerates spent antioxidants, bolsters the immune system against infections and cancer, protection against premature aging. So that's if, you've done a lot of work, there's a lot of research lately regarding our telomere length and the ends of our telomeres and how we are aging, quite honestly. It has to do with the amount of stress that we have. Glutathione detoxifies xenobiotics, so from our environment outside of ourselves, these environmental toxins, normal cell life, replication, division, and death, and DNA synthesis and repair. I mean, glutathione, it really is the mother of antioxidants, and it can help regenerate spent antioxidants, like I said. It's absolutely one of the things that is essential when we're talking about supplementation. So one of the things, though, I do want to point out about glutathione, because it kind of wears two hats in the body. There's active glutathione. So active, we think about good. We want to be active. And then there's the oxidized glutathione. And what's important is that we have more of the active in our body, because that is the form of glutathione that can neutralize these harmful substances, okay? So normal adults should have about 90% of their glutathione in the active form and 10% in the inactive form. One of my favorite supplements is a form of supplemental glutathione. It comes from France. It's unique in that it's stabilized with polyphenols from pomegranate and is delivered in the body in an active form. That's the best thing, because a lot of times people have to go and they think they need to, in order to increase the active glutathione cellularly, they got to spend all this money on IVs and, but you don't have to, honestly. You can have a sort of a liposomal, so something you can just suck on. And this is my favorite form of glutathione. Very, very important that it is active, and it's a very, very important ingredient in supplementation when we're talking about everyday detox. And once again, the ratio, we're talking about that ratio reduced to oxidized glutathione with curcumin. It really helps. This study was, and I see this a lot. And I know we're talking about detoxification, but I see this a lot. This high-fat diet, low-fat diet. The high-fat diet and it's mostly saturated fat. It starts to contribute to diabetes, metabolic disorders, cardiovascular risk, all those things, right? So this is particularly interesting. This study with curcumin, we've got a high-fat diet. That is that bar on the left. Then you've got a low-fat diet, and we're talking about glutathione ratios here. And even with a poor diet, not that I'm advocating anybody go eat a poor diet, but with curcumin supplementation, we still are protecting those glutathione levels. And so, sometimes things are out of our control. I understand that. Sometimes if I have big trips planned and I don't have food that is in my control for the most part, or I know that I'm going to be, in an airport or on a plane or in a hotel where I am going to be stressed and also not have the ability to nourish myself the way that I'm used to, a supplementation, it just assures that I can kind of level the playing field. This is something that is so important these days. It's like, I've talked about it before in some of these webinars. It's like a healthy bank account, right? And so where are you? And if I know that I'm going to be, sort of participating in major withdrawals, then I need to mitigate those withdrawals with healthy deposits. And when you supplement your lifestyle like that, that's where you keep your savings account, nice and strong, your health savings account. And that's the way that I look at these things, It's really, really important because, quite honestly, I have to tell you, I have a podcast called Mindful Medicine, and I had the esteemed colleague of mine, Dr. Joe Pizzorno, on. He wrote a book. It's coming out later on this month called The Toxin Solution. And in the Huffington Post, there was a write-up on his research that he did for this book called The Toxin Solution. And he basically said that our environmental toxins are the driver of all chronic health disease and are all chronic health issues. And I start to see that. I do, because we do have a lot of information out there now more than ever, but I still see our chronic health issues continuing to be on the rise. And so I always have to scratch my head and go, hey, what's up with that? And so we definitely want to think, okay, milk thistle. Can't talk about detoxification, cannot talk about liver health without talking about the wonderful and powerful milk thistle. It's hepatoprotective. It can actually, it's so cool for the, it can generate protein synthesis. It can actually, there's been studies from, I think it was alcohol cirrhosis of the liver. It can generate new liver cells. What about that? So repairs liver cells, excuse me, damaged by alcohol and other toxic substances. Protects that outside layer of liver cells to prevent toxins from getting inside, so it's very hepatoprotective. And what you want to look for is a milk thistle that's standardized to silymarin or silibin. Those are active compounds, okay? So when we get into plant medicines, we're looking for where have the studies been done, what is the compound that's been isolated, all right? So not just something that has a label claim that looks good when you say it really fast, all right? Now, this is something that you might have not thought about, but it is definitely something that is important to consider. Iodine is required for detoxification, especially of a group of compounds called halogens. Okay, so toxic halogens are very similar in structure to iodine. They're in the same sort of group in the periodic table and combine with their iodine receptors on the cell. So these halogens, including bromide, which basically you find that in baked goods and medications and agricultural fumigants, fluoride as well, which is prevalent in everybody's drinking water supply, chloride from disinfected water, sucralose, which is also chlorinated table sugar, perchlorates, which is rocket fuel and has contaminated groundwater, used in leather tanning, fireworks, and even been found in dairy and human milk. Okay, so we've got all these toxic halogens. It's definitely a group of toxins that if we don't have enough iodine, they can bind to our iodine receptors. And so in order to displace them, increasing your iodine intake is extremely important, okay, because it then releases these halogens and we can get rid of them. David Brownstein is an integrative practitioner, and he's a big University of Michigan fan. And unfortunately, when I moved to Michigan, I moved from Columbus, Ohio, and my parents were big Ohio State fans, and so he and I have a Ohio State-Michigan sort of kind of rivalry. But he believes that 6.25 to 12.5 milligrams of iodine per day is really the sufficient dosage to remove these halogens from the body. Okay, and I definitely prefer a blend of potassium iodide, sodium iodide, and also molecular iodine, because tissues in the body have a preference for specific forms of iodine. We're thinking about breast tissue, we're thinking about thyroid tissue, and so having a blend of them, it covers it all right? So yes, it is definitely something that I told you I'd talk about. One of the things when it comes to this modality, like meditation, because emoting, you know, once again, I think that is definitely a way to sort of get things out, right? Emotions play a huge role in detoxification. If you're not clean and healthy in your mind, you can have toxic thoughts that actually contribute to the whole mess. And so partaking in meditation. Now, meditation means something different for everybody, okay? And yes, my saying is it's never your feelings that will hurt you. It is what you do to get away from them that will. And so what I try to get people to do is, even if the meditation is an active form for 5 minutes, just a little journaling, you know, for 5 minutes, just take 5 minutes and connect with yourself. You know, we are so gosh darn connected to that, you know, 3x5 gadget that we have in front of us, that sometimes, even though it's counterintuitive, right, we think, oh, we're so connected because we have so many ways to be connected, where we end up disconnecting greatly is from ourselves. And so I don't ask people for the quantity. I've learned that doesn't work, but it is the quality and it is the consistency of being able to reattach to yourself. Just get, and in the morning it's great, so you don't, you know, sort of take off and look at your phone first and then have your to-do list sort of in your heart and your head sort of kind of, you know, depicted by somebody else, something outside of you. So the meditation, I use that word lightly. There's all sorts of ways to meditate. You can listen to binaural beats. You can listen to music, you can dance, you can do a meditation on your rebounder, but it's that intended place where you can just reconnect to yourself. And so reduces stress, enhances the immune system, decreases pain, improves sleep, all of those things that I think are really powerful and beneficial when it comes to this whole idea of decreasing our toxic load and a daily detox. So in developing a plan, so first of all, nothing in nature blooms all year. Be patient with yourself. Very, very true. Every path has its pace. What I, encourage people to do is just get started. There's a lot of information here. Start small. Incorporate maybe one of these things per week. Just, and introduce it to your family. Start just checking in with yourself and see how you feel. Make sure that you're aware of that diet that you're eating. Include definitely a friend or a loved one to sort of come along. It's like, hey, everyday retox, everyday detox. Big thing is, if you can't find the time, guess what? Make the time to prep your whole foods. It's so important, and I talk to people about this. What I do in my practice, quite honestly, from the extensive education that I've had and the extensive experience I've had in my practice, the science part about it, the practicing medicine, it's really quite easy for me. This stuff, helping people understand that steaming asparagus is a whole different, excuse me, it's a whole different animal than making a bolognese sauce. So you don't have to be a cook in order to prep good food, but it's taking that time. Very, very important, because you plan to fail. Fail to plan, plan to fail. And if you do what you've always done, you're going to get what you've always gotten. And, I've talked about it before, but when you look up diet in the dictionary, it really means habitual nourishment. So it's like taking the time to truly nourish yourself and your family. And then, of course, practice patience with yourself and stay positive. If you fall off the track, or if you feel like that bank account is slipping into debt, there's always the next step. We always have time to be gentle with ourselves and get curious. I always say get curious before critical, all right? No beating yourself up, because that usually ends up in a vicious cycle of shame where you are partaking in behaviors that are increasing your toxic load and that you're going to get more shameful about. All right, so definitely make sure you make use of the resource ewg.org. Also, for oil pulling, there's a place that I like to go online called mountainroseherbs.com. mountainroseherbs.com. They have a bunch of stuff, but that's where I get my organic oils for oil pulling. Infrared saunas are wonderful. Steam rooms, anything when you think about perspiration, getting things out. Definitely, there are some that are great and some that are not so great, but we've got DIY cleaning supplies, okay? A little bit of lemon, vinegar. It's amazing. First of all, it's cost effective. There's actually, there's a new probiotic cleaning solution out called Airbiotics. Lots of good case studies regarding nosocomial infections in the hospital, but this is using a probiotic solution. So I love Airbiotics. I think airbiotics.com is a very, very, and it cleans windows, and it cleans mirrors, and it cleans glass, and it cleans, I use it for everything. And definitely where you can find that rest, relax, and repair place, that sweet place of the opposite of your sympathetic, nervous system, which is that fight or flight or freeze at this point in time, do definitely find it. All right, I think that brings us to the end. These always go so darn fast. You can always find me at drhollylucille.com, and I'm on the radio. Mindful Medicine is definitely my podcast, and I want to thank you all once again.
Well, thank you so much, Dr. Lucille. That was very, very interesting, and I want to go right to questions. Someone asked about the website for organic eating, and we did list that in our chat. So that's www.ewg, Environmental Working Group, ewg.org.
Oh, yeah, and I forgot to say about that. It's a Clean 15 Dirty Dozen that they have, and they always update it. So when we have that darn, when we have organic, the Clean 15 Dirty Dozen allows us, to understand perhaps what you don't have to buy organic, what the exposure of pesticides and the absorption. but what you must buy organic as well, and that's the Dirty Dozen. So that's another resource that they have.
All right. Here's a question about what's your recommended daily dose of curcumin?
So one of the things, this is a great question. Boy, how much time do we have? So when I look from a clinical perspective, now curcumin has to be bound to an absorption agent to really get that, and it's very, in my opinion, dose dependent. And so I like the form that's bound to turmeric essential oils. And I like to see, you know, for people that are just practicing protection on a daily basis, you know, if I'm dealing with something more deep in my clinical practice, it's 750 milligrams, you know, once, twice, maybe 3 times a day, but certainly up to 750 milligrams for sure. And once again, it's the curcumin that's bound to the turmeric essential oils. It's an absorption agent that you can actually make sure that that active ingredient is getting into your cells.
Excellent. Excellent. Here's a question. How do you store raw vegetables in the fridge without using plastic bags?
So it is such a great question. And after I had my podcast with Joe Pizzorno, I started thinking about that. And, you know, so first of all, if I go to my farmer's market now, they have, I have the ability to bring my own bags, obviously, and they also have the paper bags. So what I do is I do my wash, I do my prep, and then I cut them up, and they all go into my glass containers. They all just go into my glass containers. My refrigerator is full of glass containers.
Excellent.
Who says I have the concentrated aerobiotic solution at home? Love it, clean everything with it. Is that Lexi?
I don't think so.
Oh.
She might have forwarded it. I'm sure
okay.
She forwarded that to you. Excellent.
Great, yeah. So yeah, excellent. Aerobiotics is I always like problem solutions, right? So I know that there is a lot of problems with those, you know, and people use them on a daily basis, those hand sanitizers that have a chemical in them that actually contributes to our overall toxic load. And so when you've got something clean that does the job, and that actually, I love it, love it, love it.
And one last question is how I'm going to combine them because they're both about Epsom salts. One is, can you use it in the shower, or do you have to use it in a tub? Is there any way you can use it, like maybe to rub on in advance or something like that? Do you have other ideas of ways to use Epsom salts except in a bath?
Yeah, so well, you can drink Epsom salt. I highly don't recommend that because that's going to give you, we use that in something called a pregnancy bomb. Well, you can do a salt scrub. So once again, I'd say stand in the shower, and without water, you can just start scrubbing your skin. But it's the soaking that allows the transfer of minerals in your body and the drawing of toxins out of your body. So there's really no getting away, excuse me, from soaking in that tub to actually get the effectiveness of Epsom salts. I apologize.
Well, thank you so much. We've gotten through all of our questions. We really appreciate you taking time out of your busy day to give us more information on how to detoxify every day since we are all living in a toxic world. And I hope that you'll come back and join us again in the future to do another one of our educational webinars.
It's always my pleasure. I really thank you so much, and thanks everybody for tuning in.
Oh, thank you. Also, I want to mention that on Thursday, March 23rd, Dr. Jacob Teitelbaum, author of From Fatigue to Fantastic, is going to give us an educational presentation entitled You Can Get a Great Night's Sleep No Matter What. So with all the epidemic of sleep disturbances and sleep disorders that we are plagued with, I hope that you will be able to join us for that one. For those of you who would like to learn more about natural medicine and healthy nutrition, we would love it if you'd sign up for our free weekly newsletter at terrytalksnutrition.com. We are very scrupulous with your email addresses and do not share it with anyone else, and will not bombard you with information, but we will send a free weekly newsletter. Also, on the Terry Talks Nutrition website, you can listen to recordings of our past seminars, and you can also ask Terry your own personal questions. We also have a YouTube channel, so if you would like to rewatch any of these webinars that we've done in our educational series, feel free to join us at youtube.com/Terry Talks Nutrition, all one word. Excuse me. You can also follow Terry on Twitter And you can find us on Facebook at facebook.com/TerryTalksNutrition. We thank all of you for your interest in natural health and hope that this has been beneficial information for you and for those you care about. If we can ever be of assistance, we hope you will call upon us, and we hope you'll join us in the future for another educational offering in the Terry Talks Nutrition webinar series. Until that time, good health to you. Bye-bye.